Welcome back to the Wellness Script podcast, your source of truth for all things health and wellness. Today's guest is Alice O'Brien, a cognitive behavioural therapist who specialises in EMDR, a specialist form of therapy that helps people to process their trauma. She's also qualified as a life coach, and we'll be talking about practical, evidence-based tools and strategies that you can implement into your life and when to seek help with your emotional well-being. Here is my conversation with Alice. Alice, you're very welcome to the podcast.
Thank you. Thank you. Jay in Dublin is always welcome.
Yes.
I'm delighted to be asked.
And it's a sunny day, thank God.
It's a sunny day, yeah. It's always sunny in Dublin.
Yeah, okay, yeah.
Sunny and cold.
I do hear that, yeah. It is
yeah.
true. We do get a good bit of sun up here.
You do.
Now,
yeah.
Alice, we are talking about a very, I suppose, a popular topic today, which is therapy. With your expertise, I'm really excited to get into it because I suppose you don't necessarily need a diagnosis or to have experienced a major trauma or a breaking point to benefit from counselling. So, but for a lot of people, of course, it can be life-changing if they have experienced those. How do you see counselling supporting people across that full kind of spectrum?
It's a really good question. I guess just to address what you just said there a while ago, maybe over the years with stigma and things, it might have been the case that, oh God, such a one is going to therapy, or why would I need to go to therapy? Sure, I'm fine. But yet we'd suffer on.
Yes.
You know, whereas now, let's just take the therapy away for a minute. There's a big move towards, you know, you can go to a life coach, you could go to a career coach, you could also go to a therapist, but it's very much kind of directed at, you know, if we're not satisfied with some part of our life, how can we change that? So that's where I would see therapy as really kind of becoming more mainstream and more important. I suppose in my job, I would see a lot of even younger people or even older retired people.
Okay.
You know, so sorry, I lost your question.
I suppose, there's a spectrum of people across which it can help. So like that, it used to only be like, say, people go to counselling if they're bereaved or, you know, like for a specific reason. Yeah. Whereas, you know, even for me, like I did therapy, I think 2 years ago I started, and I did it for a good year. I suppose, and I would identify as someone who maybe hasn't particularly gone through a major trauma, but it felt like I was getting to a point in my life where, you know, I had certain behaviours or thought patterns that were really unhelpful, and that I couldn't get myself out of them. Yeah. And that was what brought me. And that's
exactly it. I suppose the word trauma is something that we're very cautious of, but, you know, big T traumas and small T traumas is how we refer to it. But it doesn't have to be anything like that either, not saying. But I suppose a lot of us would have unprocessed things that maybe happened in our lives, or also we would have developed ways of thinking and core beliefs and ways of living around those beliefs, probably from a very young age.
Yes.
But those beliefs would have served us very well maybe when we were a child or a teenager. Sure. But then, you know, we go into the world and it's a little bit more challenging. Yes. And, you know, when you're in 6th class and you get 10 out of 10 in your spellings, you're not going to get 10 out of 10 when you're sitting in your thesis when you're 23, you know, and it's quite challenging then maybe, and it's kind of just learning how your thinking might be affecting your life. So therapy can be really helpful then for that kind of stuff. If you find, you know, that you're keep coming up against the same types of patterns or the same sort of challenges. Yes. You know, you need to maybe unravel what's going on there for you.
Yes.
You know.
Okay. And I suppose on that, like when people present to you for the first time, is it often self-directed or that someone has kind of brought them there, if you know what I mean?
Both. And I liked your question about the first session, and just to put the myth away, I always say to my clients, you know, I'm sorry that you're here for the first session, but the first session is for me. It's not for you.
Gotcha.
And you are going to leave the first session saying, oh God, that was no good. I still feel the same. You won't see any benefit in the first session. It's really kind of gathering information. It's doing an assessment. It's doing some clinical measures sometimes, depending on what's going on. It's really about harvesting the information. The therapy really will start in session 2, maybe even session 3. Okay. You know, that's the start of it. But your question was kind of
first
who
session.
Brings you or,
who brings you?
Look, I suppose to be honest, let's be honest, I would have people, maybe a few men that would say, oh God, my wife says I have to be here. Okay. You generally won't see them that often. They might come once or twice. Right. You know, unless the other thing that can happen is that can be the first session, and then their resistance will start to lower, and they'll start to see that actually I'm actually here for myself. Yeah. But really, it's like everything, you kind of have to do it for yourself. Yes. You know, maybe somebody might advise you. I would get a lot of people that would say, oh, you know, I got your number off my cousin, or I heard from my neighbour, you know, so it might be recommended. But you have to do it for yourself.
Yeah. And how do, if you didn't get a recommendation from your cousin or from like, how do you go about that's what I found really hard.
Yeah.
Finding the right person.
I would always say, look, really, the best protocol for any of us is our GPs. If we're lucky enough, we mightn't be that lucky to have a good relationship with your GP.
Okay.
But if you don't, there might be a practice nurse or somebody there.
Sure.
Most GPs will have a number of people they might refer to that they trust, that they know. But also, I suppose, make sure your therapist is, properly qualified. Ask them. They'll be very willing to answer you. Ask them before you even go. Ring them and ask them. Because if they have a problem with answering that question, maybe mightn't be, So ask them what their qualifications are. Ask them if you feel like that, what's going on for you would be suitable, because I might have people that would say, this is going on for me. Do you think it would be effective? And I would say to them, look, maybe CBT is not for you at the moment, but try something else.
Yes. Okay. And that's what you specialise in, Alice, is
CBT, EMDR, and I'm trying to start kind of mindfulness. My hope, I'm studying it, is to be an MBSR trainer. So that's mindfulness-based stress reduction.
Okay.
That's the plan.
Very interesting. We're going to get into all of that. I think.
So, look, I do love CBT. Yes. It is my bread and butter, but I am aware of the limitations of CBT as well.
Yes, and to define it for anybody who hasn't heard of or isn't familiar with, it's cognitive behavioural therapy, isn't it?
So it's cognitive behavioural therapy. Obviously, your cognitions are your thoughts, your behaviour is your action. The therapy is the thing that joins it together.
Okay.
So putting it very simply, what CBT will say is, effectively, it's not really what you're going through that's causing all the problems, whereas we do go through hard things and we do have difficult times.
Yeah.
But it's how you're filtering it through your thoughts.
Okay.
So, it's kind of stopping and learning about your thinking. You can't think your way out of everything, and thinking isn't going to make everything perfect.
Okay.
But your thinking can change your actions and can help you see things differently.
Okay.
So we would look a lot at... there's kind of a 5-area approach really that we would use for everything. Those 5 areas being, the first one being this, whatever situation you're in.
Okay.
And we look at that then through 4 lenses. How you're thinking about it, how you're feeling about it emotionally. So what emotions are coming up? Because a lot of people are very far removed from their emotions.
Really?
How your body feels. And again, very far removed from our bodies. We kind of all are really in some respect. And then what you're doing.
Okay.
So what we might look at is, this keeps happening. Why does this keep happening? What are you thinking? What's that thinking making you do? How is that thinking making you feel? And are you noticing anything going on in your body?
Okay.
And
so coming back to yourself, kind of? Is that right?
Yeah.
Okay.
Yeah. So that's how we would kind of work it. So it can be, to be honest with you, it can be a very simple approach, but then it can be very complex as well.
Okay. And is that kind of depending on what you're presenting with in terms of...
Absolutely.
Yeah.
Okay. Yeah. And then you might have somebody that might present with one thing, but when you pull that thread, you're finding something else.
Right.
Or that kind of stuff.
Okay.
So, it can be very helpful that way.
When it comes to nutrition nowadays, we're not just trying to avoid deficiencies, we're trying to optimize how we feel day to day. A lot of the people that I speak to are genuinely doing their best. They're eating well, exercising, getting decent sleep, but still feel like they don't quite have the energy, immune resilience, or overall balance that they would like. And that's one of the reasons I've partnered with Sona, Ireland's favourite vitamins, as the sponsor of today's podcast. They're an Irish family-run company with over 40 years experience, and everything they do is evidence-based, which really matters to me. With over 150 science-backed products, their range covers everything from immune and energy support to omega-3s, digestive health, bone and heart health, as well as pregnancy, fertility and children's vitamins, all manufactured, of course, to the highest manufacturing standards and repeatedly tested for purity and potency. You'll find Sona in local pharmacies, select health stores nationwide, or you can explore the full range at sona.ie. Okay, back to the episode. Yes. Yeah. Okay. So how would somebody know to go to look for cognitive behavioural therapy?
How would somebody know?
Or that it might be for them? I would
say, look, any type of therapy. If you keep coming up against the same things, the repeated patterns all the time, if you find yourself stuck in kind of loops of overthinking, worrying, keep going into the same stressful situations and not being able to figure out how you're so far down the track of this stress. How did this happen? How am I here? That kind of thing. Maybe you might find yourself kind of arguing with people or, finding people difficult to be around. Okay. I'm not saying you are the problem, but sometimes if you keep hitting the same patterns all the time, you know. And other people would say to me, you know, I'm grand. A lot of people would say to me, I shouldn't be here at all. There's people way more deserving than me. But then you would say to them, yeah, but what's holding you back? What's going on for you? You know, what's the things that keep you awake at night? What's stopping you from living the life you want to live?
Yeah.
They might say, look, I was doing grand up until a few years ago. Now I don't really feel myself. I'm not enjoying life. I'm worrying all the time. They would be the two biggest things that I would work with, really, is kind of moods and enjoyment in life, and worry.
Okay.
Worry is huge.
Yes. And with a lot of people that come to you, like, I think what I've heard from people talking about therapy is they might have a resistance to going because they're like, oh, I don't want to dig into the past, but I do want help now.
Absolutely.
Is that something you hear?
Big one.
Yeah.
Yeah. So I always kind of put it like this, you know, if you're driving down the road and you get a flat tire, the best thing for you to do really is change the wheel.
Yes.
Not go back and see how you got the flat tire.
Yeah.
So CBT would really be looking at changing the wheel, if you want to put it that way. Now, that doesn't mean that what's happened to us isn't rooted in our past, and we have to go back to the past.
Okay.
And maybe that's your original question.
Yeah.
You know, what to expect from therapy, what might be a good fit for you. Your therapy needs to be challenging. Your therapist isn't your friend.
Yeah.
You know, you're not going for coffee with someone. It should be challenging, but it should be a comfortable challenge, if that kind of makes sense.
Okay.
You know,
okay.
You probably should have a feeling when you're going in of, oh God, I have to go in here now for an hour, you know. But you should come out feeling like, oh God, I've learned this, or I've learned that. Not I've come out and feeling, oh, I feel 100% now because you made me feel so good, or you know.
Yeah, it's like I needed to do
needs
that.
To be a challenge. Yeah.
And I suppose on that same point, like, one thing that I felt when I was starting therapy was like, how do I know that this therapist is the right person?
Yeah, it's a good question. Like, I'd love to say, look, you'll know.
Yeah.
But I think what it is if you really have a lingering feeling like, you know, I really am not gelling with this person.
Okay.
I don't feel like they're aligned to my morals or my values. Then, you know, change your therapist, because it's don't worry about offending somebody. You know what I mean? That's probably what got you therapy in the first place, maybe, is that you keep putting everyone else in front of you. You know, so...
Yeah.
So, you will know, but then it should be a challenge. But also, you know, your therapist should be giving you the freedom to find your own answers. They shouldn't be giving you the answers.
Right.
You know, I would often have people come to me and say, well, my last therapist told me now that I was an overthinker, or I was this. Like, your therapist probably shouldn't be telling you that, but they could back you up when you say it, or direct you that way.
Like, what evidence do you have for that kind of in your life?
Yeah, so I'd often see people, and it's very glaring what they need to learn.
Okay.
But you have to push them into it. Do you get me?
You know, I'm sure maybe their family already told them that they're an overthinker, or, you know,
they know it themselves.
They know it themselves, so they need to come to their own kind of And it's about working through the thought process to see your behaviors and stuff. That makes sense. And I suppose from a CBT perspective, one thing that actually one of the audience asked was, how long is it something that you do long term, or is it dependent on the person?
It's a hard question. Lots of people come to me, you know, look, therapy is not cheap.
No.
I mean, I do it two ways. I work for the HSE, so my clients don't pay, and then I work for myself, and they do.
Okay, so
therapy is not cheap. It's not easy, and, you know, it's not something that we can just dip in and out of. It's not like going to the spa, you know.
Yeah.
So it's hard to answer that question, and I always kind of try to be very ethical in my answers when it comes to my clients, you know. Okay, like, they ask me, is there a minimum, is there a maximum amount of sessions? Look, minimum, you're not really going to get a lot of work done. You'd need 4 or 5 sessions at least. Okay. Right? Maximum, though, I would be cautious of somebody who's been going to CBT, and I'm not saying therapy, I'm saying CBT
specifically,
for years and years and years, because then you're saying, okay, but like, what are you ironing out now? What are you working on? What's the change method? That's a part of a CBT session. Is that there should be a change method in it, so you should be changing something or experimenting on something. And if you're going to therapy for years and years and years, you know, how much change are you actually making? Whereas therapy is different. You know, maybe you do have a therapist and you see her once a month, and you've been seeing her once a month for 5 years, and that's fine. Okay. But just be careful, like, I think maybe of therapists that might tell you, you know, you need to be with me. Next thing you're with them for 20 sessions. Yeah. You've paid a huge amount of money for that. And then you've seen no changes. You've got nowhere. Just, you know, but you're kind of bought into this idea that I should be here, or she told me I need to come back, or he told me I need to come back, or whatever.
Yeah. Just, and look, that carries across many professions. Even I know like with physio, I went to a physio not too long ago and he was like, no, if we do everything right today, you shouldn't actually have to come back to me. And I thought that's obviously different. It was physical therapy,
but it's ethical.
But it was ethical, his approach to it. And he, you know, he was like, no, I don't want to see you ideally, you know, if we've done what we needed to do and you do your exercises. So I thought that was really nice. And Alice, you mentioned that you are doing a lot of work in the mind and the body. You said a lot of us are not connected to our body. I want to hear more about that.
I suppose, look, when the teacher is ready, the pupil will come. I often mold my clients into what I want for them.
Yes, very good.
In a good way. So, like, we're very far removed from our bodies a lot of the time. You know, we kind of live a step away from it. You know, what generally will happen is, as human beings, everyone, we want pleasantness. We want niceness. We don't want to sit with unpleasant emotions, unpleasant thoughts, and unpleasant feelings in our body. So we will stay away from them. We will avoid them.
Okay.
But then we're avoiding, you know, what needs to be addressed. You know, so the mindfulness in the body, like how I work on that is we kind of do the 3 principles really in with all my clients, kind of teaching about common humanity, which means effectively, you know, anyone else is going through what you're going through would be experiencing what you're experiencing. Because a lot of people will think, something wrong with me. You know, everyone else can manage this. How come I can't manage this? There must be something wrong with me. But you're saying, okay, but if anyone else was going through this, they would be feeling and thinking and acting the same way. And there's nothing wrong with how you're acting.
Or abnormal.
Exactly. Self-compassion then would be a big one, because obviously we're huge critics of ourselves, and we need to learn to kind of stop and be compassionate and ask ourselves what might we need, or you know, what would I say to a friend that might be in this same situation. And then introducing mindfulness. It would be the third part of that. So I always feel over the years in my career, I've always kind of said, you know, practice with the mindfulness, do a bit of mindfulness, having no study done on it, having no information on it, just reading a book or something. And I almost feel like I need to go back and apologize to all those clients, because what was I asking them to do? Because mindfulness is not easy either. It's learning to kind of sit with your thoughts, sit with your emotions, not put a label on them, because we're inclined to put labels on, you know, things being pleasant, unpleasant, or neutral. You know, so I don't like this thought, or I don't like the way this person made me feel, or I don't like, you know, the emotion I'm experiencing right now. But actually, it's a thought. What's a thought? Like, it's a mental event.
It'll come and
it's a passing mental event at that. You know, so if we don't attach anything to it, it'll just pass by. You know, maybe not just kind of simplifying it, but it will pass. You know,
so we can observe. And is the competitive like piece of that, like what's competing with us being mindful is, I suppose, external stimulus, like our phones and our, like,
even our own thoughts.
Like, just thinking about something else instead.
Mindfulness, right? You say, sure, I can't even do this now. Everyone else can do mindfulness. Sure, I can't even do that because I'm thinking about the dinner or the children going to school this morning, or what I'm going to do at the weekend. But really, like, we'll say, for instance, I came up on the train today and I try and do mindfulness practice every day. It's sort of part of the curriculum or whatever. Should be part of life, really, maybe. But I did my 40-minute mindfulness exercise on the train this morning. Now, the train is not a spa. I didn't have cucumbers on my eyes. There was 4 ladies above me talking about what they were going to do for their 50th. There was the people up and down, that kind of thing. Mindfulness, it's not relaxation. It's not about, you know, totally quietening your mind, because our minds are programmed as part of our nervous system, really. Our minds are programmed to be busy, to look for threat, to be scanning all the time. But if you can just get a moment of that, if you can quieten it, just, okay, I'm going to bring back to my feet on the ground, or my, you know, bum on the seat, or whatever. If you have to do that 1,000 times, you've had 1,000 moments of mindfulness. You know, so. And
is it something you get better at?
They say I haven't got better at it yet, but I think so. I think so.
Or maybe it's, I suppose.
No, I'm being a bit unfair there. I just, personally speaking, I see a huge change in myself. Just, I suppose what mindfulness really teaches us, and CBT as well, and therapy, what we should learn in therapy, is the difference really between a reaction and a response. So, you know, if we stop and we take a breath and we have a mindful moment, even one moment, it's kind of delayed that kind of very quick response, or quick reaction that we might later regret, or later not think very well about ourselves. It kind of teaches us maybe to see a bigger picture. You know.
Okay. So, like, I suppose, kind of, if we're practicing it in our day-to-day before, or even when there's no threat, then let's say we're faced with a confrontation with the, you know, colleague or a family member, we're less likely to jump the gun kind of and jump at the response,
That's
kind of thing.
And then if you have a CBT skill, like maybe you've learned about thinking distortions and thinking. So thinking distortions are thinking styles that we might all apply. So for instance, if I react, I haven't got a chance to figure out the type of thinking I'm doing. Whereas if I can learn to respond, I can look at my thinking. So thinking distortions are things like, we've all heard them, catastrophizing, making things worse than they are. All or nothing thinking. It's either good or it's bad. It's either right or it's wrong. Emotional reasoning is another thinking distortion. So an emotion, say I feel sad. Oh, the world is bad. I feel anxious. Oh, the world is dangerous. Emotions are not facts and thoughts are not facts. They might be there to direct us to things, but they're still not facts, that kind of thing. So if we react too quickly, we haven't got a chance to kind of examine our thinking then. The other thing that mindfulness is really helpful for is the autopilot mode that we're on. Now, autopilot, there's nothing wrong with that. Like, it's like a standby mode for the phone, isn't it? Your battery would fairly be gone if you were kind of really thinking all the time. The problem being in autopilot is we will always kind of move towards a negative, when you're driving along and your mind is really kind of engaged in something else and you're not even watching the road, so to speak. You're probably always thinking about the problems or the next thing or the stresses that I might experience or what I said there or what she said or what I'm going to get her to say and him to say. Whereas if you can practice mindfulness, what actually might start happening quite slowly, but it does happen, is when your mind goes into autopilot, it doesn't always go to negative. It can go to maybe a more positive experience or even more neutral experiences.
But first you have to observe, isn't it? The first thing is to realize that is where, and it's where all,
and non-judgment.
You're not a negative person. We're trying to protect ourselves, I suppose, evolution-wise from threats. But in our modern world, most of the time we don't have a real threat to our existence. It's kind of like an email or
it's interesting, isn't it? Like you were asking there about the nervous system. I always think about the nervous system is our inner alarm. It's the smoke alarm. If the alarm went off here in this building, we'd probably need to get up and do something. It's there to help. I suppose the problem is in the modern life, the alarm has gone off in the wrong places. But people will come to me and say, do you know what I want now for therapy? I want to not feel anxious. I want to not be worrying about the kids or whatever. And you say, it's not going to happen. You can't have a life with no anxiety. You can't have a life with no worry. It's there to help you. It's there to direct you. What you need to learn is, okay, my fight or flight is switched on here. Why is it switched on? What's going on here? Why am I in this kind of sympathetic nervous system all of a sudden? And do I need it to be on? Can I change it to the parasympathetic? Can I change it to the rest and digest? And how will I do that? Rather than my fight or flight is on. Who am I going to fight? What's going on?
So when you go to therapy, then if you're the kind of person who does want to be less anxious, you maybe are looking for patterns in your thought patterns, behaviors with someone who's neutral and not involved in your life to kind of be like, and why do you think that way?
And why was that switched on for you so quickly, and what was happening there for you?
What I found with talk therapy was the type of therapy that I did, which, it's just, I suppose you can define it better than me, but talking. And I found that actually the pause was where I got most of the value, like as in she would just kind of like, she would ask very helpful questions, but also sometimes I'd talk about something and she kind of look at me then and then I'd almost answer my own question, which I thought was really, really
But she knows how you're going to answer. Probably. No, maybe not. You might surprise her. But a lot of the time, she's kind of biding her time. Kind of saying, we might come up with something here. If we don't, we'll see where we go.
I don't want to. And I found that to be very, very helpful. And I suppose we mentioned earlier that you do work in trauma. You mentioned a couple of abbreviations, one of which was EMDR. What is that, and who does that apply to?
So EMDR is eye movement desensitization and reprogramming. It's a very grand title, isn't it? How it works is effectively. Now, I don't use a lot of EMDR, and I have colleagues who are trained in it that really love it and really swear by it. And I suppose I'm very lucky in that regard then, that if somebody's looking for EMDR, I nearly always kind of send them that direction. But I do use it as well. It's very good for regulating on a very basic level. It's very good for regulating the nervous system if you are having a session that might be, challenging for a person. But how it might look. So EMDR is good at processing and, reprogramming the memories that we might have. So me try and explain it to you. Say you had a filing cabinet. Think about your brain as a filing cabinet, right? And all those files in your filing cabinet have been nicely put there by you, and everything is kind of nicely stored. And generally you kind of store your files at nighttime when you're asleep, when your eyes are doing that rapid eye movement sleeping.
Yes.
But it's nicely filed, right? But supposing there's a trauma.
Okay.
Big T, small t. Trauma is an inner wound. So something that has wounded you internally, it's completely subjective.
Okay.
So what I will find traumatic, you might not find traumatic. Sure. That's just important to say. So now all of a sudden your filing cabinet, all your files are being thrown out on the ground.
Okay.
Right? That's bad, but you can't live like that. So you're going to pick them all up and get on with things. That's what we generally will do as human beings, is just get on with life. And you'll try and file things back kind of as suitably as you can.
Okay.
And that's great and you get on with your life, but occasionally you might have filed the wrong thing in the wrong place in terms of your brain. So you might be experiencing, some things might trigger memories, you might be getting flashbacks.
Okay.
You might be wondering why, it's very distressing for me to hear a certain thing or smell a certain thing, or, memories keep popping up in the wrong places. I'm just driving along and this traumatic memory will come up. Okay. So how EMDR looks in is you hold two kind of vibrating pulsars. They're like little eggs.
Okay.
Small little plasticky things.
Yeah.
They have lights in them, and you follow the lights with your eyes, and it bilaterally stimulates the brain, and it helps you to kind of reprogram and reprocess that memory then.
Okay.
So it's a little bit like almost being a fly in the wall of your own memory. It's not as hot then for you, or as distressing as it might have been.
Yes.
Before.
And it's a way of processing trauma.
Yeah.
Okay. That and that's something that you see works with colleagues. No,
I have colleagues that really love it and are very invested in it. I'm not saying I'm not. I just do other things first. Yes. That would be my first protocol,
Sure. Which would be like the likes of cognitive behavioural therapy.
Yeah. Absolutely.
And the mindfulness.
Yeah.
And I think a big piece in any kind of therapy, I know this is something that you talk a lot about, Alice, is self-compassion. Like you mentioned a lot of expectations. People come in and, I don't want to be anxious anymore. I think that is also a self-criticism that I shouldn't be this way.
Exactly.
Yeah, I am this way and I shouldn't be.
It's a real problem for us, the word should.
Yes.
I should be doing this. Other people should be doing that. You know, that's a real problem. It's learning. Your inner language is important, you know. So self-compassion, you asked me earlier in the week about resources. Christian Neff, Neff, is the guru really of self-compassion. So if you wanted to kind of find any of her work, it'd be very interesting. But really, self-compassion is non-judgment. It's kind of, compassion focused therapy has 3 systems it works on.
Okay.
The soothing system, the threat system, and the drive system.
Okay.
And it kind of tells us that we can't have, only one of them can be on at the same time.
Okay.
And for a lot of us, we might not, our self-soothing system might be the smallest of those systems.
Right.
So we're either in that threat system of kind of being in that fight or flight, or the drive system, trying to get somewhere to prove something.
Yes.
And our self-soothing system is not really working very well. So self-compassion can, increase that self-soothing system. Okay. So we can soothe ourselves rather than looking for other.
And you teach people to be more compassionate towards themselves.
Yeah. So we're trying to do a bit of that kind of compassion-focused work, or
Yes.
Yeah,
that's really interesting, because I think we're so good at like soothing others or giving advice to others, and then we'll do the exact opposite.
Yeah, I always say to people, it's a simple question to start asking yourself, like, would I speak to my best friend the way I've just spoken to myself now? Because again, like I said, your inner narrative is the only narrative really. What other people will say to you, well, it'll hurt, but it mightn't be as hurtful as what you would say to yourself.
Yes.
And you're saying that to yourself all day, every day. All of the time. For God's sake, why did I do it like that? Or why did I say that? Or why didn't I? But you wouldn't, sit beside your friend and just continue on kind of ridiculing your friend all the time. Yeah. So why do you do it to yourself?
Yeah, and we list like our, the mind is always listening. Even when you say stuff out loud, I've become more conscious recently of like, compliments. Like in Ireland, we're so bad at taking a compliment. Yeah. And like if someone says, "Oh, you're dressed nice," whatever, like not being like, "Oh, like, oh no, this whole thing, like this is this is awful," or like just whatever we usually say, but actually being like, "Thank you."
But I think a lot of it is generational in one respect. Like we might hear our mothers, "Oh, I won't be in the picture now, take me out of the picture. Oh God, I look desperate in that." And we need to stop doing that.
Yeah, absolutely.
We need to stop kind of the first thing that comes to our mind is a negative, because it's getting us nowhere.
No, exactly. And I think hopefully now we're setting better examples for younger generations. I have a little niece, and I would hope that like it would only be I would only ever want her to hear me and my sister say, speaking, positively about ourselves, so that then she's like, oh, I'm beautiful and I'm great. And, like that kind of way. So I think it is really important for children to hear their moms or their
you could start with being neutral before you start, because it can be quite hard maybe to be complimentary towards yourself. That can go against your grain really, because, but just be neutral.
Yeah.
Okay, I'm not going to think that, or if I think that, I'm not going to believe it. Thoughts are not facts.
Yes.
Just because you think something doesn't make it true.
So yeah, I think that's key, and maybe for anyone who's listening, if they could practice that even this week, is just observing like what their thoughts are.
2 things that I say all of the time. I often think I should get a poster and put it on the wall in my room. Is the first one being thoughts are not facts.
Yes,
that's a big one. Just because you think it doesn't make it true, right? The other one that I use when I'm doing a lot of kind of worry sessions with people is, what can you learn the difference between a worry and a problem?
Okay.
So people will come back to me and say, God, like I learned it wasn't a problem, it was a worry. Okay. In other words, you can't do anything about a worry. It's abstract, it's out there, it's uncertain. But if there's a problem, you can engage the problem solving part of your brain and you can use that and solve the problem.
Yes.
But the problem solving part of your brain won't work on a worry. So if it's a worry, if you can,
it's just rumination then, isn't it?
Yeah.
Okay. So and isn't that part of it as well? In terms of anxiety, I always find it helpful to, like take action. If it's something I can either do something about it, or I have to accept that I can't do anything about it. Yeah.
On the reverse of that, or the opposite side of that, is we can also not take action.
Okay.
So a lot of the issues around why we might have anxiety in our bodies is because, so you take a footballer off a football pitch in the middle of a match and you plonk him down there inside the therapy room.
Yeah.
And then you put him beside the fella who has anxiety, right? Their symptoms will be the same.
Okay.
What's going on in their lungs, their heart, they're sweating, there's a lot going on. It's the same thing. The difference is that there's a couple of things, but the thinking is the biggest thing that's changing. But also the fella that's on the football pitch is moving.
Yes.
He's moving around, so a lot of his kind of blood gases are changing and things like that.
Yes.
So whereas you are not when you're anxious. But it's kind of learning that, okay, if I sit with these symptoms, anxiety has a ceiling. In other words, like you can't be anxious for 10 hours of the day.
Yes.
If you are anxious for 10 hours of the day, it's new anxiety, if you know what I mean.
Yeah.
Anxiety has a cycle of about 90 minutes. Now, 90 minutes is very long if you feel very anxious. But the more you learn to sit with it, the shorter that cycle will become. The lower the ceiling will become.
Okay.
So if you start avoiding when you're anxious, if you start trying to get rid of your anxiety, you're never giving that ceiling a chance to lower.
Okay. And when you say avoiding, what does come to mind is things like doom scrolling and things like that.
Absolutely.
Is that something that's relevant?
That's kind of mental avoidance, but just general avoidance. Like I might see, people that aren't going to school.
Okay.
Simple things, people that kind of always went to the local restaurant and now they're not going there.
Okay.
Or, always went to the local supermarket and can't go there and that kind of thing. But you're never learning.
Okay.
So with CBT, we would do a lot of behavioural experiments, that being, graded exposure to things like that or that kind of stuff. Yeah.
And is that what you hear when you, like everyone online keeps on saying exposure therapy? Is that?
No, I suppose I don't want to answer that because exposure therapy could be another thing.
Okay.
But I would use it it's very good for OCD. We use kind of exposure and response prevention. Now that's quite technical, but, exposing yourself to the threat and stopping yourself from responding, by neutralizing. But that's quite technical.
Right.
But what is it? So we would do like a graded exposure. So we might do kind of a fear hierarchy. So to give you an example, I'm trying to think. Okay, so my fear might be, I'm afraid of Dublin and I can't go to Dublin.
Yeah,
right?
Sure.
So, but I might start with getting on the train somewhere else, or I might start going somewhere that I can kind of push it a little bit.
Okay.
And it might take me 3 or 4 goes before I get on the train to do what I need to do.
Yes.
I wouldn't just jump into the deep end of the pool.
Sure. Yes. So gradually.
That's what graded exposure would mean.
And you're grading the challenge
exactly.
that's going to present.
Yeah. So it has to be challenged, but it can't be so challenging that you might avoid it or kind of find mental ways of getting out of it.
Yes.
It needs to be challenging, but not too challenging.
Okay. Okay. Very good. I like those points that you shared. Is that, a thought is not a worry.
Thought is not a fact.
A thought is not a fact.
Absolutely not a fact. Just because you think it doesn't make it true.
Yes.
And learn the difference between a problem and a worry.
Yes.
If you have a problem, solve it or don't solve it. That's up to you. It's a solvable issue. If you have a worry, you can spend all night long thinking about it, but you won't reach any conclusion. So,
being able to spot that for yourself as well. And I think like you mentioned as well, like I suppose a whole person approach is really key with therapy. And you also mentioned, you know, about taking action and mindfulness, and you also practice as a life coach as well. Is that right?
Not really. I have life coaching qualification, but
does that come into your practice
a bit,
though, in terms of directional?
Maybe informally,
Yes.
Yeah, it might do informally.
Yeah. Because I think that's key as well. I think because when I saw that as one of your qualifications, I think it is interesting because you share so much with your therapist.
Yeah.
That while, of course, as you said, your therapist isn't going to tell you what to do, but it is interesting to have an idea as to directionally, you know, what that person might want from their life.
It's a caution tale, though. Be careful, because there are life coaches that are pushing themselves as therapists or pushing themselves as like.
Yeah,
I suppose we had an issue there lately where somebody was advised by their life coach to come off their medication, or you know, those kind of things. Really, just be careful.
Yeah,
you know, a CBT therapist or any type of kind of a therapist with ethics will never actually tell you to do something that's harmful to you.
Gotcha.
You know,
yes.
So just be careful that way.
Or cross into the realm of another healthcare professional, which would be if your GP prescribed that. Exactly. Then you stay with that.
Yeah.
And I like that you mentioned that as well, because it's not either or in terms of medication. If you're on medication for mental health,
of course, there's room for everyone. When it comes to medication, I usually use the analogy of the life jacket. I'm a great woman for stories.
Good.
So if you want to learn to swim in the sea and you have a coach that's going to teach you to swim in the sea, they'll probably tell you to wear a life jacket for the first 6 or 7 sessions, and then you might be brave enough and take the life jacket off and hope you don't drown. You know?
Yes.
Think about medication like that. If you really are on the fence, if you're against medication, that's fine too. But if you're doing talk therapy and there's a possibility that you might need, you know, an antidepressant or, you know, whatever, advised by your GP or your psychiatrist.
Yes.
It will make the therapy, I don't want to say quicker, that's wrong, but a more kind of enlightening experience at the start.
Yes.
So it might be that you might kind of pick up things faster if you're on the medication. But look, it's not for everyone, and that's perfectly fine as well.
Yeah, you know? But it's good to know that you can do.
But definitely liaise with obviously either a psychiatrist or your GP.
Yes.
You know, don't take advice from anyone other than them.
Yes.
Really, including therapists.
Yes,
you know?
Absolutely. So I suppose if someone's listening and they've been thinking, okay, you know, I don't always have the best thought patterns, or I have these behaviors in 2026, I want to finally kind of stop avoiding or finally deal with things. Like, what would be your advice to them?
I would say go for it. Go for the therapy, but don't feel that you have to stick with somebody just because you phoned them and you've been once. If you don't feel good about it, go to someone else. Try other therapists. You know, your people don't get off into that easily.
Yes.
But definitely, like, I suppose we're only responsible for ourselves, so we have to live our lives in the way we want to live them.
Yeah.
Do you know what I mean? Like, nobody's going to live our lives for us.
Yeah.
Nobody's going to make everything okay for us. We have to be responsible for that ourselves. So if you feel that you know, want to change something in your life and yet you've tried to change it and it hasn't worked out for you, then definitely take some help and go for the therapy. And you don't have to tell anyone if you don't want to, if you really want to get into the whole stigma of things. Your information is your information to keep, so you don't need to be telling people.
Yeah.
You know, people won't judge you anyway, we would hope. And if they judge you, they're the wrong people. You know, but...
And your therapist is bound by ethical.
Absolutely,
they're not going to tell anyone, even if they're local or they know some.
Well, I work in the rural area, so you will. And I always say to my people, if you say hello to me, say hello to me. If you don't, you don't. We won't be offended in either way. You know, a lot of time you get the nod or the, you know. But obviously, your therapist, of course, is bound by, you know. Well, obviously, I'm a nurse as well, so I'm. You know, the MB, what you call them, the board alternate. Like, we're bound by code of conduct, so we obviously don't. Obviously, we wouldn't say anything to anyone, of course.
Yeah, but I think that maybe as healthcare professionals, that's obvious to me and you, but it is also important to say, because, you know, especially in a rural area where you feel like maybe, you know, and I always say,
you know, I've been 26 years as a, you know, what was called a psychiatric nurse. It's probably called a mental health nurse now, but it was okay to say psychiatry in my time.
Okay.
I trained here in Dublin. I've heard it all.
Yeah.
I've seen it all. I've worked in forensic settings. I've worked everywhere. You won't shock me.
Yeah.
And if you do shock me, it's probably that I empathize with you, or I wonder how you got through that. You know, because people surprise me every day for so many reasons. But there are people that have gone through so much stuff.
Yeah.
And they're still there. Yeah. And they have a smile on their face and they're coming into you and they're telling you about the challenges and you're like, yeah, how are you still going?
Yeah.
And yet they are like.
And you wouldn't know. I think that's the point.
Absolutely.
Like you could be friends with someone, they might have been going to therapy for years, maybe they didn't tell you.
Absolutely.
But and I think that's more people than you realize do get that kind of help.
Yeah.
And I think something you mentioned to me earlier when we were having a coffee as well was about the power of community. And I think I would love if we leaned more into that this year. My
thing, I say to my clients, is my 3 Ps, and they all come back to me and they say, I listen to the 3 Ps or thought of 3 Ps. So people, purpose and pleasure. That's the balance that we need in our lives.
Okay.
So we need meaningful connection.
Right.
And, it might sound a bit simplified, but I hate self-service checkouts, right? Yeah. They're great for flying through, but you're never, the person at the self-service checkout is not going to ask you, how'd you get on last week at the bingo? Or, how's the young fella? Or, actually, I love watching people. I was out in the street there a while ago and I love the Dublin exit and everything. And one fella said, Happy Christmas now if I don't see you. And is your mum still in hospital? Yeah. Those kind of things. Yes. Like, these were 2 people passing. Obviously, they knew each other.
Yes.
So we need meaningful connection. So we need the connection that we can lean on, but we also need connection.
Yeah.
So connection is huge. Like if you're lonely or isolated, go out and do a bit of gardening and see if the neighbour will talk to you, or go for the walk and make eye contact with the person, that kind of thing. The purpose then, you need to end your day with a sense of purpose. It might be something as simple as making sure you wash your wear after you use it, or that can be huge for a person.
Yes.
And pleasure, then we need to get enjoyment out of things.
Yeah. Have a bit of fun.
Have a
Let
bit of
loose.
Fun. Yeah.
Not as serious as we make it out.
Absolutely. Yeah.
I think that's really key. I can be inclined to be a bit serious. So I think that's really nice.
Yeah.
So I think we'll take those 3 Ps with us, Alice.
3 Ps,
Carry them into the year.
Yeah, I love when people come back and say, I did the 3 Ps this week.
Yes.
Like, wow.
No, that's brilliant, Alice. Thank you so much.
No
I think that hopefully that was really helpful for anyone listening.
Yeah.
And I think that we will definitely carry those into our week and into our year, of course, that we're at the start of. So thank you for joining us. Make sure to follow Alice on all of the channels linked below.
Yes.
And she puts out great information out there. So it's really helpful. Thank you, Alice. That's it for today's episode of The Wellness Script. If you enjoyed it, hit subscribe. It really helps us grow and keeps these evidence-based conversations coming with top experts to help you with your health and wellness. Follow us at Wellness Script Pod on Instagram and TikTok so you don't miss an episode or a live event. And a big thank you to Sona Vitamins, Ireland's longest established nutritional supplement producer, for supporting the show. Catch you next Wednesday with a brand new episode, your prescription for better living.